today. I thought I would start with how it is that I'm here talking about climate change and health equity. This is my family at the top left, my 2 sons and my husband, and we just finished hiking up from the bottom of Yosemite Valley. We love to go to national parks, and we were seeing, over the years, we've seen more and more dead trees. And as I started to learn, when I first started seeing them, I wanted to understand what was happening to the trees. And what I learned was, with climate change, we were seeing more bark beetles, and the trees were basically being put into a terrible choice between holding on to enough water or fighting off the bark beetles. Now that I'm a public health nurse, so I learned more about climate change and the public health impacts, and realized that we're all being impacted by climate change, but even more so where the communities where I grew up. This is my 8th grade class, and I'm the middle there in my pink and white shirt. Communities like the one I grew up in are being impacted even more so, and I'm going to talk more about that as we go along. So in 2016, I joined Citizens Climate Lobby, and it's a volunteer nonpartisan group that has been working on trying to get carbon fee and dividend legislation passed, which is a way to reduce our carbon emissions. And they help you to learn about the science and talk about it, and they actually help you to meet with members of Congress, some of whom you may not share your values with, but I've learned a lot from them. And basically, whether you join an organization or not, we need more climate advocacy. And the 3 areas that are needed is, first, adaptation, and that's basically where we're trying to reduce the impacts of climate change. So an example of that would be cooling stations when it's really hot. The second area is mitigation, and that's where we cannot adapt our way out of this if we keep putting pollution into our atmosphere that's overheating our planet. So that carbon fee and dividend is an example of that, to lower our emissions. The third area is education and leadership. More of us need to help the public and help our leaders understand what climate change is and how urgent it is. And we need more leaders to stand up and say, yes, let's work on this issue. So before I go forward, I just want to make sure we're all kind of on the same page when it comes to climate change and global warming. A very simple explanation is, we've always had changes in temperature, and we've always had some cycling of carbon. What is different is we humans, and especially in the last 60 years, have taken a tremendous amount of stored carbon in the form of fossil fuels, and we've burned them and put them up into our atmosphere, where they are acting like a blanket, causing the earth to overheat. If we continue to put that pollution up in our atmosphere, it is going to make it very hard for us to live here safely. A simple other way of thinking about it is, if you think about a car with the windows up, the heat gets in, it's trapped, and the temperatures go up and up. Now, if you're kind of thinking, yeah, but do we really know that humans are causing this, or it's still kind of undecided? I'll tell you, a big reason those thoughts are there is the fossil fuel industry has done a tremendous job of spending a lot of money to make it seem like there's doubt about the science. If we leave their product in the ground, they stand to lose trillions and trillions of dollars. But make no mistake, there is scientific consensus on this.
If 97% of all dentists told you a tooth couldn't be saved, you'd pull that tooth. If 97% of all engineers told you your house was unstable, you'd move. And if 97% of all airline workers told you not to get on a plane, you wouldn't. So, when 97% of the world's climate science experts tell you our planet is warming and we're responsible, why would you ignore them? When you're 97% certain, you're certain. Protect America from climate change.
So the science is certain. There is consensus.
If 97...
And yet, we are not taking action. And so there is a U.S. call to action on climate, health, and equity. And the reason equity is included is we know that climate change is not impacting our communities equitably. This website has nurses and doctors who are telling the stories of their patients who are already being impacted by climate change. We don't have time to watch this, but this is one example. It's a doctor in Georgia, and she's talking about her patients with respiratory chronic conditions and how rising pollution levels due to climate change are causing them to have worse asthma and other respiratory issues. Now, next slide is a CDC, kind of a broad overview of climate change and public health impacts, and they have a great website, Climate Change, Public Health, CDC, if you want to learn more. In the center circle here, you have those rising CO2 levels that are acting like a blanket, overheating our planet and causing severe weather events and rising sea levels. Then that next circle is some of those impacts like severe weather, water and food impacts, extreme heat. And then in the outer squares, you see some of those public health impacts. Now here in Arizona, we are seeing, because of climate change, we are seeing increasing wildfires and other pollutants that are causing more air pollution. There are increasing allergens and allergenic content. And so we see increasing cardiovascular and respiratory allergies. We were also experiencing more extreme heat. Over 400 Arizonans died last year from heat. In fact, heat actually kills more people than any other weather-related event. We're also seeing water impacts here and food supply issues, and vector-borne diseases are increasing as well. Now, since the beginning of the industrial age, about 1880s, we have been increasing our temperature so rapidly. Normally, a rise of 1 degree typically takes about 1,000 years. We have done it in about 100. With it, we are seeing increasing fires, hurricanes, droughts, loss of crops, all these things worldwide. Now, if we do nothing, we're actually heading for 2 or more degrees of warming, and with it, we're increasing our risk of catastrophic events. We don't want catastrophic, so we're trying to keep our levels below 2 degrees, and in fact, the next 2 slides are going to demonstrate the difference actually between 1.5 and 2 degrees, which is pretty significant. So we're really trying to keep our warming below 1.5. And in order to do that, we actually need to reduce our carbon emissions by half by 2030 and down to 0 by 2050, which I'm sure you can imagine is a daunting task, which explains why this is such an urgent issue for us. So these 2 slides demonstrate the difference between 2 and 1.5. As you can see, it really makes a difference how many people are going to experience extreme heat, how much species loss we will experience of vertebrates, plants, and insects, how much food loss we're going to experience. And this one's really depressing. Coral reefs with 1.5 or 70–90% gone. With 2 degrees, they're pretty much gone. As well, we simply can't afford to go on as usual. This is billion-dollar events each year, climate event disasters. And as you can see, it's just been going up and up and up. In 2020, there were 22 events. We can't afford not to address climate change. Now, this is just a brief overview of some of those health impacts. So as I said, air quality, we're seeing more intense wildfires and increasing pollution because of the rising temperatures and CO2. As well, allergens, there's actually more allergens and more allergenic content. And so those cardiovascular, respiratory, and allergy-related illnesses are going up, and with them, emergency room visits and hospital visits. Extreme weather, we see property loss, infrastructure damage, death, and I think a big one that's not listed here is mental health impacts. And sometimes not even necessarily only in the place where these disasters are happening. A lot of us felt a lot of pain from California and Australia's fires. Rising temperatures, I talked about, and also be aware that there's a heat island, urban heat island effect, where some of our communities, typically our communities of color, can be as much as 12, 14 degrees hotter. We also see increasing vector-borne diseases, the same reasons that there are far more bark beetles are impacting some others, such as ticks. And so we have seen Lyme disease double from 1991 to 2013, and some of our other vector-borne diseases are increasing as well. So when we talk about who is affected most and why, it's very similar to COVID-19 reasons. The first is exposure. So if you work outside or your house is really poorly built, you are going to be more impacted by rising temperatures. For sensitivity, if you're a child and your lungs are developing, or you already have asthma, you're going to be more impacted by increasing pollution. In terms of ability to adapt, if I only spend 3% of my total budget on my energy needs, I have room for an extra month of really hot temperatures, but someone who's spending even as much as 30% of their budget, they just don't have room for those additional hot days in their budget. So when you take those into consideration, we identify vulnerable populations, and I'm sure many of you will notice that these are very similar to our COVID-19 vulnerable populations. I'm a maternal child health nurse, so children and pregnant women stands out for me. But the second one, definitely communities of color, low income, immigrants, and limited English proficiency groups stands out for me because that is the community that I grew up in. It is my 8th grade class in a nutshell. And when I think about why those communities are so much more impacted by COVID-19 and by climate change, all I have to do is think about my walk to school. I had to walk along Buckeye Road when I went to school, and Buckeye Road was a major truck route, so lots of diesel trucks running through. There were lots of very polluting industries in our neighborhood, including a National Superfund site less than 3 miles from my school. Overhead was a major Sky Harbor flight line, always planes going by, and we were less than a mile from I-17. Every time we were walking in our neighborhood, we were inhaling all those particulate matters that are damaging our lungs and causing inflammation in our cardiovascular system. Is it any wonder that those are the communities that are being impacted so much worse by COVID-19, and is it surprising that climate change is also impacting them as well? Now, when you look at those communities and what are some of those differences and impacts, you have to look at some of the historical influences. And I'm not going to hit on all of these. I'm just going to highlight one, which is redlining. So if you're not familiar, in the 1930s, the banks put circles around communities, and they were, of course, predominantly immigrant and communities of color. And they said, we're not providing loans in these areas. So people couldn't buy their houses, they couldn't invest in businesses that were needed in the community. These communities were also targeted for things like transportation routes and very polluting industries. We see today, if you do a mapping of heat islands, if you do a mapping of poor air quality, of high asthma rates, of high rates of heat illnesses, you can actually, on a map, see those same red line communities by putting circles around those same kind of high incidences. So these historical influences are still impacting those communities today. And they're impacting them because of some of these key social determinants, like lack of access to health care, inequities in the health care. These neighborhoods are just different. They're more polluting, they're hotter, they lack access to services. There's poverty, there's weathering, those experiences of microaggression and racism on a daily basis that impact physical and mental health. There's food and resource insecurity, issues with access to technology, and some of our communities are even lacking access to electricity, running water, and modern communication methods, especially our tribal communities. Now, the next set of slides, I'm going to talk about some of the impacts from climate change and why it impacts some of our communities of color especially. So when you talk about extreme weather and Black and African American communities, well, the 6 states with the highest African American population are also the same ones that have increased risk from Atlantic hurricanes and extreme storms. But also because of discrimination, they're less likely to be homeowners and to have adequate insurance. They're less likely to have financial cushion and medical insurance and care access when these events happen. For our Indigenous communities, there's already a lack of infrastructure, And when there's damage to the infrastructure they have, a lot of times there is not the funding to be able to repair it. And then when you add to that a lot of pre-existing conditions, so if I need kidney dialysis and the road is washed out, something that would be terribly inconvenient has now become life-threatening. And we talk about extreme heat. We know that our urban heat island impacts are greater in these neighborhoods. They don't have green spaces, the buildings are poorly built, and there's inefficient cooling equipment. Basically, what it costs to cool per square foot is much greater, so they have a greater heat burden, and at the same time, they have a less ability to pay or adapt. So they are in this terrible choice of heat or eat. When we talk about air quality, the Latino community is more likely to live in counties that violate clean air and ozone standards. They're more likely to live near major highways. And in fact, Latino children are twice as likely to die of asthma. When we talk about sea level rise, we all know this, property values determine where we put protection from sea level rise and flood barriers. And for our communities that have a lot of undocumented immigrants, they're not eligible for federal disaster aid, and they may be fearful to seek other kinds of help. As well, poor quality housing is more likely to be at risk for flooding and things like mold. Now, food insecurity, and this is one that I always think not only within the US where we have a problem, but also worldwide where we have some countries with extreme problems. And when you think about all the heat and drought and extreme weather that is destroying crops and what that means in terms of climate migration, as well, some of those, when the CO2 levels are higher, there's actually lower protein and micronutrients in the food. So they can be getting the same amount of food, but it's actually less nutritious. So again, more expensive food and less nutritious. In our indigenous communities who are more likely to use subsistence living, so they're fishing, farming, and hunting, we see those same impacts, but also a decrease in their hunting and fishing areas and some of their salmon and trout habitats. So again, food shortages and increased prices. So how do we build climate resilient communities? Well, it starts with climate justice. And climate justice is both a term and a movement. And the idea behind it is we know that communities of color have actually contributed far less to the pollution, and yet they are the same communities who are being impacted far worse. So the idea behind climate justice is that we would use mitigation and adaptation to address those social, economic, public health, and other types of injustices that these communities are enduring. Now, a couple weeks ago, I happened upon this Black, Indigenous, People of Color Climate Justice Dialogue. It was amazing, and I have a link to it. It was really great, and I ended up including some of the things that were expressed during that talk. I loved this speaker, she was awesome. But one of the things she said was climate change is the result of a legacy of extraction, of colonialism, of slavery. So how is it surprising which communities are being impacted? And I really have thought a lot about what she said, and it's so true. When you think about the fossil fuel industry, it is all about extractionist thinking, that it's okay to extract the oil out and benefit a very few number of individuals and companies at the expense of so many of us, even at the expense of our children. Why is that okay? They also talked about something hopeful, which was the Biden-Harris executive order on tackling climate crisis. Within that executive order is the Justice 40 initiative, and it plans to spend 40% of overall federal investments in disadvantaged communities. And the target of that spending is clean energy and energy efficiency, clean transit, affordable and sustainable housing, training, and workforce development. So some really great things for our communities. And it made me think of I attend a energy insecurity work group, and they shared this story of a single mom and her family. And because of the poor building quality, she was spending $800 a month to cool her home. They weatherized it, and now she's paying $200 a month. What a difference. And so it's things like that we can do. So again, this was another, I loved some of the things that Mia Yoshitani said, and I think we're at this moment where we can keep saying, okay, this extractionism is okay, or more of us can stand up. It can be a transformational moment. And she says, we need a transformation of our economy, of our democracy. We need a transformation in our relationship to the planet and to each other. I just love that. And when you think about what we want to emulate, what kind of values we want to emulate, they pointed out that indigenous people make up only 5% of the world population, yet they protect 80% of global biodiversity. These are the values we need to emulate: taking care of our earth, taking care of the creatures on it, and taking care of each other. So what we need is solutions that work for everyone. And I have to share, there are some awesome solutions out there, but the one that has made me the most hopeful in the last year is soil regeneration. And the idea behind it is, right now we are killing the soil. It's living, soil is living. We're killing it with herbicides and chemical fertilizers, which ironically are made also by fossil fuel companies. And the idea instead is to take care of that soil, and what's amazing is it can sequester carbon and it can hold more water. So there's some hopeful solutions out there. So what is recommended is that we advocate for community-driven strategies and priorities, that we work with local governments and leaders, that we engage the community in planning for climate change, and that we invest in implementing community-based solutions that, very importantly, provide opportunities for our residents, and then that we mainstream climate change in school curriculum. My last two slides are about things, if you're interested, you can look at your footprint and make some changes, but I really encourage you to keep the big picture in mind, and that is, we cannot do enough by individual change. We need systemic change, and that means something like a carbon fee and dividend, because we need the people that don't always do the right thing to have to do the right thing. So call your representatives, but the most important thing you can do is talk about climate change. Talk about it with your peers, talk about it with your family, with your colleagues, and use your area of expertise to be a climate advocate. And this is a really great 8-minute TED Talk that was phenomenal. And it's about how to talk about climate change, because we know the science has decided, we know we're in trouble, we know it's urgent, yet we're still doing nothing, and it's a failure to communicate. So use plain, obvious, and universal language, help people to understand that this matters to them, and show that climate change is an issue for people like them. And the last thing I'll leave you with is this quote from Amanda Gorman. Every time I try to practice it, I get emotional. So sorry, you just have to read it. She gives me hope. And I invite you to be the light. Sorry, I don't know why. It's a great quote. I love what she said. All right, sorry.
No, no, thank you. That was a great talk. I'm going to stop recording, and then we'll start our